welcome to Health Mantra. I'm Heather, and today we turn our attention to a growing concern, the rising incidence of prostate cancer across the country. In today's episode, we will explore everything from risk factors to treatment options and how early detection and the right form of treatment can make all the difference. Now, to help us understand this better, we have in the studio Dr. Sujoy Fernandes, a consultant in radiation oncology and palliative care at Manipal Hospitals, Goa. Dr. Sujoy has an MBBS from Goa Medical College and an MD in radiation oncology from AIIMS, Jodhpur. He's an expert in advanced radiation treatments and has been at the forefront of research in adaptive radiotherapy and cancer genetics. Dr. Sujoy, it's a pleasure to have you. Thank you for joining us on the show.
Thank you.
So, prostate cancer is the second most common cancer in men today. Can you tell our viewers what prostate cancer is and what are the different types?
Okay, so prostate cancer is a cancer of the male gland that is just below the urinary bladder and in front of the rectum. And the function of the prostate is to provide nutrition for the seminal fluid, for the sperm basically. It provides enzymes, fructose, proteins for the nutrition of the sperm.
Okay, and what are the types? Are there types?
Okay, the types are, there are two main types. One is adenocarcinoma of the prostate, which is a common one, and the other one is the neuroendocrine carcinoma, which is the rare variant. Adenocarcinoma is far more common and far more seen in patients.
Okay, and the rare variant is the one that is more aggressive.
Yeah, the rare variant is aggressive, but fortunately it's much rare.
So now 60% of, you said adenocarcinoma is more common, and 60% of adenocarcinomas are found in men 65 and older. Can it also be found in younger men?
Yes, it can be found in younger men, and it's usually seen in those men of the younger age group who have a family history, like the first degree relatives. The father is also a case of prostate cancer, and he also had it in the younger age group.
Okay.
So we suspect that he probably may be having a genetic mutation that has been passed on to the patient.
And then, so then it would present in much younger. So when you say younger, what age?
In less than 50 age group.
Okay.
And it's better to get them screened for a genetic mutation called BRCA, BRCA.
Do we have these tests here in Goa?
Yes, we do have these tests in Goa.
Is there an upward trend? Are we seeing an increase in the number of cases across the country?
Yes, we are. Because of the lifestyle change and lack of exercise, because of these reasons, there is an increasing trend globally. And not just globally, even within Goa, like during my current practice, I have seen that the number of cases are
on the rise.
Quite a few, yeah.
Okay. So every year, what you're trying to say is that every year there are more and more people being diagnosed with prostate cancer.
Yes.
You said it had to do with lifestyle changes. Are you talking about diet? Are you talking about alcohol, smoking, stress? What is it?
Yeah, actually it's a combination of these. So the patient may be living a sedentary lifestyle. So he may
no exercise.
No exercise, yeah. And he may be an alcoholic, or he may be having a long history of smoking. So such patients, they have a higher risk of developing prostate cancer during their lifetime.
What about things like diet?
Diet also plays a role, like fatty foods, red meat, then increased sugar intake. These all can contribute to the...
Highly processed foods?
Yeah, highly processed foods. These all can contribute to the risk of prostate cancer.
So basically what you say is family, so genetics is one, and then you have a lack of exercise.
Yes.
You have bad habits, so smoking, alcohol, and you said...
poor diet habits.
So all of this contribute to prostate, to the likelihood, higher likelihood.
Of prostate cancer.
But in a majority of patients, it is a silent disease. So there are no outward symptoms. Is that correct?
Yes. See, because prostate cancer is not a very aggressive disease. The neuroendocrine variant is aggressive, but it is much rare. I'm talking about the common one, the adenocarcinoma.
Okay.
It is not that aggressive, and it's very slow growing. So
Okay.
patients basically are not diagnosed with prostate cancer in the early stages. And sometimes, even though they get prostate cancer, they may not live long enough to diagnose that they
Okay.
have prostate cancer. And
Because of
yeah,
old age.
yeah, and maybe during later, by chance, if we happen to find it on autopsy, then maybe we can see that there is a growth in the prostate.
Okay.
So it is not a very aggressive tumor to have.
But are there any symptoms that would present?
See, suppose if the tumor enlarges to a big enough extent, to a size that can cause symptoms like there can be urinary obstruction. This is
Okay.
like the most common symptom. That is urinary obstruction. The patient may have to apply force during passing urine, or there can be a stop in the stream of
Okay.
urine during while passing urine. Okay, then there can be incomplete voiding, like the patient has to go to the bathroom once, and then maybe after some time he has to go and void again.
Okay.
So these are the few symptoms, and especially in older age men, these are a few symptoms that points towards having prostate cancer.
Now, all of these symptoms that you just mentioned are, at a when the disease has developed to a much later stage.
As in later stage, as in the prostate gland has increased in size,
Okay.
and the patient is having symptoms, then we know that.
But don't you recommend that men get screened so that we can catch it earlier? By what age, or at what age do you think that men should start getting screened for prostate cancer, considering that it's such a common disease?
Okay, see, I would say beyond 50 years of age, I think all men should undergo a PSA test, prostate specific antigen, like at least once a year.
Okay.
Beyond 50 years of age. And suppose if there are risk factors, like genetic risk factors, like family history and all, within the first degree relatives, like suppose if the father is having prostate cancer or the grandfather is having prostate cancer, then it is better to get screened at an earlier age, like
So
45.
Okay, 45.
Yeah.
PSA, you said. So a PSA, does it tell you definitively that you have prostate cancer? Or suppose you get abnormal PSA tests. What else do you do to tell for sure that a patient would have prostate cancer?
Okay. So PSA and the other test would be other modality would be to do a digital rectal examination, in which we feel per rectally, like through the rectum we feel a nodule anteriorly, like just in the anterior part of the rectum, the frontal part of the rectum. If we feel like the gland is enlarged, then we would suspect, or if it is firm, then we would suspect that the patient could be having the disease, or if the PSA is on the rise. So PSA is not very specific. It can increase in various conditions like prostatitis, that is inflammation of the prostate, some prostate infection, and even a digital rectal examination can cause a transient rise in PSA.
PSA, okay.
So even a biopsy from that gland can cause a transient rise. So what we do is we take a PSA level at least 2 to 3 times, and instead of seeing the absolute value, we see the trend.
Okay.
So if the trend is on the rising side, we suspect that the patient may be having the disease, prostate cancer. And then secondly, there is something called free PSA and total PSA.
Okay.
So we take the ratio of these two parameters, free PSA and total PSA. If it is somewhere less than 12 to 10, then the patient is at a higher risk of having prostate cancer. Like if the ratio is more specific, then doing a PSA
then you
alone.
do the further diagnostic tests.
Yes.
Like your rectal exam and your prostate biopsy.
Yes, yes.
Are these painful procedures?
They are usually done under the
anesthesia.
Yeah.
Okay. Now, being diagnosed with prostate cancer is not a death knell that we know.
No.
So, if detected early via all of these screening tests, can it be cured completely?
Yes, it's completely curable. Prostate cancer is a very slow growing disease, as I mentioned earlier. And it takes very less time to spread to other sites of the body, to metastasize. So if detected, even in an advanced stage, it can still be cured.
Okay.
Okay. And even once it has spread to other sites like bone and other sites of the body, I have still seen patients who have had prostate cancer in other sites other than the local site.
Okay.
And they are with me on follow-up at the moment for the past 3 to 4 years.
So basically what you're saying is that life expectancy can be increased.
Yes, with the current treatment modalities.
So what are these treatment modalities that you're talking about?
Okay, so we decide first by doing we investigate first to find out the stage of the disease.
Okay.
And how far it has progressed.
Yes.
Yeah. So if it is localized, then we treat it definitively.
Okay.
Okay. Definitively in the sense that we use there are two modalities: surgery or radiotherapy.
Okay.
And current studies have shown that both of them have the same
success
rate, same outcome. So as a radiation oncologist, I treat the patients using the advanced modalities of radiotherapy. And the current radiotherapy techniques have a very few incidences of side effects and compared to the earlier modalities.
Okay. Doctor, when you speak about radiation therapy, it is widely believed that it's a very toxic form of treatment. Is that true? Are there, does it cause a lot of side effects?
With the current radiotherapy modalities, the incidence of side effects have reduced drastically compared to the older forms of treatment in radiotherapy. Like we use techniques such as IMRT, then image-guided IGRT, VMET.
Okay.
So these modalities, they help in reducing the dose to the neighboring structures like rectum and all to a very great extent, and making the radiation dose highly localized to the prostate itself.
Very targeted.
Very targeted. So the risk of side effects are not as much as it used to be.
Okay.
So even though patients may have some minor side effects, like they may have an increased urge of passing stools or increased burning during maturation, they are all manageable during the course of radiotherapy. And once the course is over, they have completed with the radiation sessions, then it all comes back to normal.
So just like any other chemotherapy, the side effects are just temporary.
Yes, yes.
So once you're done with your radiation therapy, you're done with your cancer treatment, everything goes back to normal. You can go back to a normal life.
Yes, definitely. The patient can go back to his normal life.
Now, this is, you're saying not only if it's detected early, but also if it's detected at a later stage, you are still able to treat it more successfully than perhaps other forms of cancer.
Other forms of cancer. And even once the cancer has spread to other parts, the chemotherapy or immunotherapy modalities that we have now still has a very high success rate, even if the patient has distant metastasis, like it has spread to other parts of the body.
So even if it's spread to your, say, bones and
lungs.
Yeah. Okay. Doctor, let's talk about surgery. Now, I know that's not what you deal with, but is it better to get surgery or is it better to do your radiation therapy? What do you think?
See, it all comes down to patient preference and the condition of the patient. Suppose if the patient prefers to get surgery, then we give the patient the option of surgery. And if he doesn't want to undergo surgery, then radiotherapy is also an option. And even the condition, suppose if it's a disease of the old age, basically.
Okay.
So if patient is unable to undergo a morbid procedure and all, then we would always recommend radiotherapy as a good option.
Now, this is in patients, say, around 65. What if your patient is, say, 85, and the number of years that the patient has to live are, say, fewer in number?
Yeah.
So do you still go for something like surgery? Do you still go for radiation therapy? Or do you just prefer to, watch and wait kind of method?
Yeah, so prostate cancer is a slow growing disease. So watch and wait in patients who don't have much of a life expectancy is always a good option, and it's also a good option because at that age he may not be able to tolerate such kinds of treatment.
Okay. Whether
Because
invasive or otherwise.
yeah, yeah.
You have to tell me whether it's a myth or a fact. And either one, if you can, very briefly explain why it's a myth, why it's a fact. Okay. So myth or fact, prostate cancer only affects older men.
It's a myth because it can be seen in younger age groups also.
Myth or fact, a high PSA level definitively indicates prostate cancer.
That's a myth because even high PSA can also be seen in prostatitis and other infective conditions.
That's got nothing to do with cancer.
Yeah, a serial PSA would be required.
Myth or fact, having no family history of prostate cancer means you're not at risk.
That also a myth because lifestyle also plays a role, and age also plays a role in developing prostate cancer.
Myth or fact, prostate cancer is one of the easiest curable cancers out there.
Yes, it's a fact. Like it's slow growing and there are very high response rates.
And even at advanced stages, it can still be cured completely.
Advanced stages as in locally advanced stages. The metastatic cases, it cannot be cured completely, I would say, but it is very well brought under control.
So it can be managed.
It can be managed, yeah.
Doctor, myth or fact, prostate cancer doesn't always need to be treated.
That's a fact. Because in older age groups, like I mentioned before, 80 plus, 85 plus, where the life expectancy is less, then we can keep the patient on active surveillance. Even when the disease is low risk, like it's not very aggressive, the Gleason score, that's a pathological scoring system, is less. And if it is small in size, then we can consider to just monitor it.
When you say that, we'll monitor it, how does this monitoring work?
This monitoring works by like you can do a 3-monthly PSA and see if the PSA is increasing, or we can do a 6-monthly MRI. So we would know.
Okay. And how long can you watch a cancer before you go in and say, okay, I need to treat it now?
Okay, so suppose if the patient is developing symptoms and there is a sudden rise in the PSA, or suppose if the MRI shows an increase in size, sudden increase in size, then we know that the disease is growing in size, getting more aggressive. That's when we decide to treat the patient.
Doctor, myth or fact, it is widely believed that if you live long enough, you will develop prostate cancer. So there's no escaping it. Is that true?
That I would say it's a myth because some men may not develop it during their lifetime, even if they live long enough.
Okay. Dr. Sujoy, you spoke about surgery and radiation therapy as the two forms of treatment. Besides this, do we have any technological advancements that, perhaps in the future?
Okay, so in locally advanced disease, in local disease confined to the prostate and the pelvis area, radiotherapy and surgery is the current modality. But in case the disease spreads to bone, say for example, then immunotherapy can also be a good choice. It helps in increasing the life expectancy. And the other modality would be to use radioisotopes.
Okay.
That is done mostly in the nuclear medicine department, in which they inject a radioisotope, and these isotopes, they settle within the regions where the disease is spread. Okay. And emit radiation from within.
Oh.
Okay, so this helps in controlling the disease to wherever it has spread.
So all of this is available here in Goa?
Yeah, it is available in Goa.
Doctor, there's another belief that, in patients suffering from prostate cancer, you have a lot of urinary problems. Once you're cured, do these problems all go away? Whether it is, surgery or radiotherapy, either forms or both forms?
Okay, see, before undergoing radiation therapy, it is always, I would say, mandatory to get a ultrasound of the pelvis, just to know like how much urine the patient can void. Okay, how much is left behind in the bladder. So
Okay.
and to do a uroflowmetry also. These two investigations are mandatory. And once we know that the patient is has a good urine function, then we can go ahead with radiation therapy, because radiation therapy can during the course can although it will get better later on, but during the course of treatment the urine function may worsen. So we get these things checked first and then go ahead. And suppose that before starting therapy, these uroflowmetry and ultrasound are showing poor urine voiding function, then we dilate the urinary tract so that the patient is able to pass urine in a is able to pass urine with ease, and then we go ahead with radiation therapy.
Now, this is, you're talking about during treatment.
Yes.
What about once a patient is cured completely of the disease?
Yeah, then the prostate gland obviously it shrinks in size after radiation. So then the obstruction is reduced. So the patient can pass urine with ease.
What about, if the patient's undergone surgery instead of, say, radiation therapy?
Okay, so the risk during surgery is that the patient can develop incontinence. So the patient may have to pass urine more frequently and have the urge to pass urine. But now with current surgical modalities also, the risk of incontinence has reduced.
So what you're trying to say is that you can go back to a perfectly normal life.
Yes.
Do you have any practical advice on lifestyle choices or preventive measures that men can adopt to reduce their risk of developing prostate cancer?
Okay, so lifestyle choices would be exercise. First thing, exercise daily. That helps in reducing the risk of prostate cancer. And in case the patient is an alcoholic, or if the person is an alcoholic or a smoker, then he can cut down on those. And diet choices, like he should avoid processed foods and stick to more healthier options instead.
What about exercise and
Yeah.
stress? Do these also play a role?
Yeah, these also play a role. In case you're diagnosed with prostate cancer, there is absolutely no need to panic. There are multiple treatment options, and the overall outcome of treatment is very good. So there is no need to worry. And secondly, I would say is to exercise more often and choose healthier lifestyle options. When the patients have prostate cancer in a younger age group, it's better to get them screened for this genetic mutation because it helps in the later on silencing this mutation can help in the therapy as well. And men over 50 years of age should get screened more often, a PSA test at least once a year, so that you'll know your current disease status.
Thank you once again, Dr. Sujoy, for that incredibly insightful discussion. It's been an absolute pleasure.
Thank you.
To all our viewers, if you or someone you know is at risk, please, as doctor said, please don't hesitate to get screened. Consult a specialist, because early detection can make all the difference. If you have any questions or you would like a consult, Dr. Sujoy is available Monday through Saturday, 9 a.m. to 5 p.m. at Manipal Hospitals in Donapaula, Goa. Thank you for tuning in to Health Mantra with Manipal Hospitals. I'm Heather, and I'll see you next time. Until then, stay healthy, take care of your health, and keep watching Prudent Media.